Welcome to Learn Medical Spanish. This is the third in a series of ER Nurse episodes, and this one covers general statements and questions, so stuff you might use throughout the patient visit in the ER, and I'm sure it'd be useful in other settings like urgent care or even on the floor sometimes or whatever, but I'll share each phrase in English first, and then I'll give you a chance to think about the translation a little bit, and I'll share it in Spanish and say it twice, and give you time to repeat it after me each time out loud. So ideally you want to be saying these phrases out loud to get some practice, because that's the hardest part of learning Spanish and using it, is just being able to say things out loud. All right, so the first phrase, here's the first phrase. I need to put in an IV and draw blood. So think about how to say that. I need to put in an IV and draw blood. Necesito ponerle un catéter y sacar sangre. Necesito ponerle un catéter y sacar sangre. And give IV fluids or medications if needed. Y darle suero o medicina si se necesita. Y darle suero o medicina si se necesita. So suero is just kind of a shortcut for saying IV fluids, because they'll usually understand it that way. All right, next phrase. May I use either arm for an IV? ¿Puedo usar cualquier brazo para el catéter? ¿Puedo usar cualquier brazo para el catéter? And to measure blood pressure. So again, if you can use either arm, so to measure blood pressure. Y para medir presión de sangre. Y para medir presión de sangre. So when I misspoke a little on the first phrase, that's just an example of how there's multiple ways to say things. I started to say for a catheter, but I had written for the catheter, and it really wouldn't matter which way you said it, but that's just, there's a million ways to say things, but this is just one way. All right, so here's the next phrase. We need a urine sample. And there's probably 10 different ways to say this, but here's one example. Necesitamos una muestra de orina. Necesitamos una muestra de orina. Can you try to urinate now? ¿Puede intentar orinar ahorita? ¿Puede intentar orinar ahorita? And why do we say ahorita instead of ahora? Well, ahora can mean today instead of just now. So it's a little more specific if you say ahorita. All right, so next we're going to say please, and this is going to be like a cheater command. I did an episode on that a while back, so cheater command. So please, as in please do something, but please, favor de, take these pills. So we're completing that phrase, favor de blank. Favor de, take these pills. Tomar estas pastillas. Tomar estas pastillas. Drink this medicine. Tomar esta medicina. tomar esta medicina. So I tricked you on that one because you probably wanted to say beber for drink, which is fine. That's 100% correct if you said that. But tomar can mean taking anything by mouth, eating, drinking, whatever. All right, next phrase. I will inject medicine for pain, nausea, infection. Voy a inyectar medicina para dolor, náusea, infección. Voy a inyectar medicina para dolor, náusea, infección. So that was kind of a long one. Sorry about that. All right, so the next one is, I need to ask the doctor if you can eat or drink. Necesito preguntar al doctor si puede comer o beber. Necesito preguntar al doctor si puede comer o beber. I will ask the doctor for. Voy a pedir al doctor. Voy a pedir al doctor medication for pain or nausea. Medicina para dolor o náusea. Medicina para dolor o náusea. And if you didn't like that translation of medication to medicina, then there are other ways, words that sound more similar, like medicamento, but it doesn't really matter which one you use. All right, so next, these are other things that you're going to ask the doctor for. Voy a pedir al doctor, blank, blank, blank. So another one is to come speak with you. Que venga a hablar con usted. Que venga a hablar con usted. Couple quick notes. So maybe that seemed complicated because we used the infinitive in English and then we conjugated it in Spanish. But and so if you simplified it and say, voy a pedir al doctor venir a hablar con usted, I'll ask the doctor to come. That's not how you would usually say that in Spanish, but I think people would understand you and you'd get your point across. So if you find yourself simplifying something like that, you'll be all right for the most part. And then another thing is what the original phrase, I will ask the doctor for, maybe you accidentally use like preguntar instead of pedir. But whenever you're requesting something, somebody to do something, then you're going to use pedir. You're not going to use preguntar. Preguntar is just like asking a question, getting information, basically. All right, so a couple more things you might... never mind. So the next phrase is, do you have someone to take you home? ¿Tiene alguien para llevarle a la casa? ¿Tiene alguien para llevarle a la casa? And if you said su casa instead of la casa, that's fine. Again, there's different ways to say things, kind of pros and cons sometimes, or sometimes it's more clear, sometimes it doesn't matter. In this case, it doesn't really matter. All right, so next is we are waiting for, and then we'll list a few things. Estamos esperando. Estamos esperando. And what are we waiting for? So one thing would be your results from the lab. sus resultados del laboratorio. Sus resultados del laboratorio. And then next, this is a little awkwardly phrased because of the way the translation works, but the next ones we're waiting for them to come do your imaging, or like somebody to come do your imaging or something like that. Que vengan a hacer la radiografía. Que vengan a hacer la radiografía. So that, again, is a little bit of a mouthful or a little more challenging grammar there. That's the subjunctive because it's a future thing that's a little uncertain. So that's why we're saying vengan instead of vienen, like present tense or something like that. All right, so other things we might be waiting for. We're still esperando, estamos esperando. Your imaging results. Sus resultados de radiografía. Sus resultados de radiografía. The X-rays, the CT, the MRI. Los rayos X, la tomografía, la MRI. Los rayos X, la tomografía, la MRI. So yeah, that's kind of weird and funny, right? But I think if you're in the United States, most of the time it's you can just say MRI. La MRI is probably technically correct because it's la resonancia magnética, but you could probably say el MRI and get away with it. And then la tomografía, because I don't think they just say CT, but maybe you could also say CT and get away with that at some point. But tomografía obviously would mean like tomography, right? All right. And then one more thing we're waiting for example, would be your inpatient room assignment. Su asignación de cuarto para pacientes internados. Su asignación de cuarto para pacientes internados. And that's one of the times where I left something in parentheses because you could just leave it out completely, like that second half where it says para pacientes internados. If you just say your room assignment, that's probably good enough, right? And by the way, internados is just one way to say like inpatient or hospitalized. You could also say hospitalizados. That's a longer word, a little more difficult, but it sounds a little more like English, so that's kind of good. All right. And then the last, might be the last phrase, we'll see if there's another one, is I will remove your IV and return with your discharge papers and the prescriptions. Voy a quitar su catéter y volver con los papeles de alta y las recetas. Voy a quitar su catéter y volver con los papeles de alta y las recetas. Okay, I kind of stumbled over that, but that's kind of a long phrase. And then the discharge papers, that's something that I kind of recently learned, but it seems like that's kind of the correct way to say that. I would usually just say they'll come with the papers or the instructions or whatever, but de alta seems to be how they say, like if it's for a discharge or for going home or whatever. All right. So If you haven't already, you can check out my very focused beginner lessons via email. I'll send them to you if you go to learnmedicalspanish.org/lessons, and I'll put a link below either on the podcast or YouTube, wherever you are. These are super high yield, especially for providers. And then if you're on YouTube, here's a couple playlists you can look at, basic Spanish or other dialogues. And if you're on the podcast, just scroll down and you can see a lot of that same stuff. So thanks a lot for being here, and I'll see you next time on Learn Medical Spanish.